Hi, I'm Ashley Carter. I'm a pediatrician here at the SouthernMED Pediatrics South Lake location. So hand, foot, and mouth is definitely out there right now. It often starts with fever. Within a couple days, you'll see a rash. That can include hands and feet, palms and soles, and it can also include other areas, legs, arms, diaper area or genital region. There's also usually a sore throat associated, so maybe some trouble swallowing, or if the child's older, they'll tell you that their throat hurts. We usually see this in infants all the way up to about 5-year-olds. Rare complications, you can, because there's blisters, if they'll open up, you can get a secondary infection, so you do want to watch the skin for that. Occasionally, a few weeks after the illness, you can see loss of fingernails or toenails. Doesn't happen frequently, but can occur. Very rarely, you may see something called a viral or aseptic meningitis with hand, foot, and mouth, and that's when the child gets a high fever, stiff neck, very bad headaches, and those do need to be watched and seen in the office, often hospitalized while they're cared for, but that, like I said, is a very rare complication. So hand, foot, and mouth is a virus. It's in the enterovirus family. The most classic one is something called a Coxsackie virus, but it can be a few other strains of enteroviruses as well. So it's transmitted through secretions from the nose and mouth, so saliva or mucus, sneezing, coughing. It's also transmitted through the blister fluid, so if you have the rash and the blisters have opened up, that can transmit it if someone's touching or playing with a toy and then another child plays with that same toy. And it's transmitted in stool, so diaper changes are one way that that can move from person to person. Typically, like we said, it's in younger children, so infants up to 5 years of age, but older children and adults can also get hand, foot, and mouth. Usually the symptoms aren't as prevalent, so they can carry it and transmit it without even knowing that they have it. So hand washing with soap and water, covering sneezes and coughs, washing toys or wiping down toys is very important this time of year to try to prevent the spread of hand, foot, and mouth. So treatment is usually going to be based mostly on keeping the kid hydrated and pain control. So if they're old enough to have Motrin, you can do ibuprofen. If not, just Tylenol for pain management. Some of the older children can also do a mouthwash type gargle thing to help with the sore throat. And then you've really got to make sure they're staying hydrated, pushing fluids in all kinds of creative ways, and watching for signs of dehydration, because if those occur, then IV fluids may be needed, so they'll have to be checked out and treated appropriately. So, of course, a lot of times you'll get a call from the daycare, it's going around in your classroom, and then all of a sudden your kid pops up with a fever, and then classically the symptoms come up, and you know how to treat it, you know to keep them hydrated. So if you're not seeing any signs that are worrisome, if the child is still drinking well, eating okay, having good wet diapers, and you know the fever is brought down with your Tylenol or Motrin treatment, you don't have to bring them in right away. If you do have concerns about, ooh, is this little spot infected, or we're kind of behind on our fluid intake, then we'll be glad to check them out and help treat appropriately.